Okay, for a serratus punch, they're going to elevate their arm to 90 degrees of flexion, keeping their shoulder blade neutral, so not into any elevation. And then they're going to protract, bringing their fist towards the ceiling at a rate of 2 seconds, holding for 2 seconds, and then really focusing on that eccentric phase, bringing the shoulder blade just back down to the table with 3 seconds. So up 1, 2, hold 1, 2, down 1, 2, 3. So for prone abduction, again, we want them in external rotation, and they're going to come up just to the level of the horizon, or just parallel to the ground, coming back down, and again having that scapular retraction and depression as they're coming up. Go ahead and come up again there, and back down. Again, this is really good for the middle trapezius. I know Ann Cools talks about having them go through a scapular pattern, which you can find as weak, but in general, most patients are going to be not coming into enough retraction or depression of the scapula. So for prone shoulder extension with external rotation, we want their arm in full external rotation. That again has been shown to increase activation of the lower trapezius. And they're going to extend their arm back just to the level of the hip and back down. As they're coming up, they're going to retract and depress the scapula and coming back down. And again, you do not want their arm coming past the level of their hip. That's going to put too much anterior stress on the shoulder. And we want that coupled retraction and depression through the scapula as they're coming up. For sideline shoulder external rotation, which is going to be really good activation of our infraspinatus and teres minor, we want to have the towel roll there. Reinhold's study showed that gets better activation of the infraspinatus. Then you want to have the patient retract and depress their scapula and keep it retracted and depressed throughout the whole exercise. And then they're going to keep their elbow at 90 degrees or a little bit more and not moving at all from the elbow. Keep their wrist neutral, and they're going to rotate up as high as they can and back down. So it's just a pure rotation through the glenohumeral joint. You're watching to make sure they're not substituting by elevating the scapula or losing any of the depression or retraction, as well as making sure they're not substituting through the elbow by either extending the elbow or supinating as they're coming up. Okay.